Hi, I'm Dr. Sumathy PremAnand. I'm a gynecologist and an obstetrician, and I'm also a fertility specialist. I live in Arumbakam, Chennai, India. I'm here to share with you some of my knowledge, and I wish to educate you a little bit. I won't be boring you, but I hope it is useful. Today we are going to discuss about what we are going to do with the newly married couple. You may be a person who is planning to get married, or it could be your friend or your relative. What advice can you give them, or what advice can you take for yourself? When we plan for a wedding, the first thing we choose is the would-be spouse, right? You're going to choose the wife or the husband. You may be knowing them earlier, or you may not be knowing them earlier, or it could be a marriage which is going to be fixed by your parents. Times have changed from the time I was doing medicine. I have been practicing medicine for the past 26 years, and I have been in the field of obstetrics and gynecology for the past 21 years. I have been meeting women from all classes and places for quite a number of years. I find that the mind of humans is very intriguing, especially when it is related to marriage, conception, contraception and abortion. I thought it was essential for a person who is planning to get married to know certain things. We as Indians try to concentrate on a lot of things which is relevant to the wedding, but are we planning life after that? We plan our wedding, we have a wedding planner, we go selecting saris from Kanchipuram, we go selecting, you go to T Nagar and then select all the jewels for yourself or the spouse, and then we invite people and we do a big gala wedding. But there's one thing which happens following the wedding, right? A baby is going to come, whether you like it or not. So this is what I am planning to tell you. Whether you like it or not, a baby is planning to come if you are not aware of it. When you are planning to go for a wedding, get married rather, kindly go for something called premarital counseling. You can do that with your medical practitioner, or you could get the knowledge probably from the internet, Google, and find out what exactly you should be doing and what you should not be doing. What I would like to say is, when you are planning for a wedding, you must know that the act of marriage is going to result in a sexual intercourse. That is probably going to result in a baby if you are both healthy. Weddings are planned in different couple. You may be planning to have a baby a year later, 2 years later, or you may be coming from families, or you yourself may be wanting to have a baby soon after you get married. So kindly think what you and your spouse actually wish to do. There are only two things. You are going to have a conception, or you are going to have a contraception. If you are planning on a conception, meaning if you are planning to get pregnant, or if you are your spouse is planning to get a pregnancy as soon as the marriage is done, all you need to do is make sure that you both are physically healthy, emotionally healthy, spiritually healthy, financially healthy too. When all this is there, then probably you are planning to have a baby when your heart wants it. When you meet a medical practitioner, I am sure people will be talking to you about a periconceptional folic acid. This has a lot of benefits because it prevents a lot of problems which can come in the baby which is going to be formed. 3 months before the planned pregnancy, please, the woman has to take 1 single tablet of folic acid, which does a lot of good for the baby which is going to come later. Plan the pregnancy accordingly. You can go through a menstrual calendar which would say which are the conception days. In a person who is menstruating for once in 28 days, The conception would probably occur between the 12th to the 18th day, around the 14th day roughly. Planning the intercourse around that time probably will result in a baby. You can read books, you can watch movies, you can Google a lot on the internet to know what exactly you must be looking forward to have a healthy baby. A medical practitioner would also be advising you on that. So that's regarding a person who is planning to have a baby. What about people who do not want to have a baby soon after the marriage is done? Kindly practice something called contraception. There are so many methods around the world. See, if you want to take a medicine for malaria, for example, or typhoid, for example, there are just 1, 2 or 3 type of drugs which you can use to treat the problem. But you know how many contraceptives are available for men and women? Innumerable. You know why? Because the practice of sex actually involves the emotional aspect of the couple. The man may be willing to use it, the man may not be willing to use it, the woman may be willing to use it, or the woman may not be willing to use it. So plan who wants to use a method to avoid a pregnancy which you are not planning to have right now. So this method is called contraception. So there are male contraceptives and female contraceptives, and because we are discussing to the general crowd as such, let us stick to some small and common things. When you are using a male contraceptive, it is nothing but the regular condom. The male condom is the most widely available method and the most used method throughout the world. Every time during a sexual act to use a condom will prevent the pregnancy to a lot of effort. The failures following condom contraception are minimal. You can take it this way. If you don't use a condom and if you are not using any other method, 100% it might result in a pregnancy when you are not planning for it. If you are using a condom, the chances of failure of a condom is probably 1 to 3%. That is all. You must choose what to do. Just in case the male doesn't want to use a male condom, the female has a choice. The most widely used method is the oral contraceptive pills, which need to be used every single day starting from the second day of the menstrual cycle. These are available pills in 21 packs or 24 packs, and every month you will have to be using the pills to avoid the pregnancy, and these have to be taken under the advice of a medical practitioner like me. Please approach a medical practitioner who is well versed in using these things and prescribing these things, and make sure that you are a candidate who is fit to use an oral contraceptive pill. There is something called emergency contraception which I would like to tell you right now. Emergency contraception pill is used in case you've had a sexual intercourse without protection, or if a method what you have been using has failed accidentally, meaning you have failed to use the condom on that particular day. You have had a condom which is broken during the act. You have not used the oral contraceptive pill on that particular day or the previous day. At that point of time, the intercourse would have happened and there is a likelihood of an accidental pregnancy. In this time, you will have to approach the practitioner and find out what you can do as an emergency protection to avoid the pregnancy. These are very simple methods which you can use just for 2 days. They will prescribe you pills for 2 days which you can take and avoid a pregnancy. The failure rate is very less. I am sure you would have understood by now what is male contraception, what is female contraception, and what is emergency contraception. And I have come up with methods only for the newlyweds as of now. I am sure this basic thing can be taken up by you. Have a happy married life, have a good contraception, avoid a pregnancy which you are not planning, have a pregnancy when you want it, and lead a healthy life. Best wishes to you. I am sure you would have gained a little bit of knowledge from what I have been talking so far. This is a small segment what we have covered about men, women, conception and contraception. There are a lot more things which we will be talking about. Let us meet you in other segments. Please subscribe to this channel. Thank you. See you.